Hi, my name is Dr. Lori Puskar, and I'd like to talk to you about health and the true definition of health and what it means to be healthy in regards to the symptoms and problems that you're currently experiencing. So I've created what I call a health chart, and we're going to go through this because your health is a little bit more complex than you're being told or being educated on out in the raw public. And when people ask, like, well, why should I come to you, Dr. Lori? I want to explain to you why and what it is that I will do that's different, and it'll help you really achieve true health once and for all. So I have it set up as a health chart, and we're going to do it as a pie chart. And there's many reasons that you're not healthy or not doing well. So these are in no particular order. We're just going to do them alphabetically. And let's say, for example, you go online and you read something, or your neighbor's like, you know what? Your health situation might be due to the air you're breathing in your house, dirty air, somewhere where you work, some smog you're being exposed to, where you live, etc. So you read all of these articles and you're like, wow, maybe my lung situation or my allergy situation is truly due to the air I'm breathing. Now that could be true, but that's a very simplistic viewpoint, thinking that the one thing will cause the other thing. That's possible, but probably not probable. Huge difference. So I'm definitely going to advocate that we need to breathe better air, and air quality is definitely important, and there might actually be some filtration systems or things you're going to need to do in your environment to handle the air quality situation. But to think that that one thing is going to be the thing to handle your health overall is quite a very narrow-minded viewpoint. And that's what's kind of being promoted out there, is that you handle this one thing and it'll just magically cure everything that's going on in your health. And there's no one that would love that to be more true than me. I mean, my job, my life, my work would be about 1/1,000,000th of the effort and energy that it takes to get a sick person well and handle your symptoms once and for all. But it's not that simple. And again, that's what we're here talking about. So air, definitely a part of the situation, and definitely something you need to look into and that I analyze, but may or may not be the whole story. The next thing, a lot of times people are talking about their immune systems, and you could have a bacterial situation. You'll see people going online and reading about natural immune systems to handle bacterial situations. So good, again, thinking that possibly why you're healthy or why you're not healthy is because of a bacterial situation. It's quite possible, but again, may or may not be the whole story. Now, the other thing you can see here are these pie slices are exactly the same size, meaning that there isn't going to be anything that's more important than the other one. So let's say you have a chronic lung situation due to the fact that you have a low-level bacterial situation in the lung tissue that's maybe been there for years, and on top of that you're breathing in poisonous air. It's going to be the combination of these two things that get you the true handling to the lung. It's not air versus bacteria, it's possibly air plus bacteria. Now, there's also other factors that it might be, and this is again a lot of where online learning is a dangerous thing, because they're trying to tell you like the reason for your situation is this one thing, and I'm here to tell you, and we're going to share all the things that it might be. So number one, it could be an air situation. Number two, it could be a bacteria situation, or it could be both. The next thing it might be from a dietary standpoint is that you're eating too many carbohydrates. So now this is where all of the fad diets come in. Everyone's like low carb, high fat, keto, paleo, caveman diet, all of these crazy wild diets. It could be that you're eating too many carbohydrates. It could be that you also have an air and bacteria situation. It could be all three, as you see. Maybe what you're doing is you're feeding the bacteria by giving it too many carbohydrates in your diet, and the goal would be not so much to try and kill the bacteria, but starve the bacteria by not giving yourself the carbohydrates so that the body can continue to reproduce these bad pathogens. So again, equal pie slice, because a third of the situation from, again, a lung standpoint, let's say, is that the air you're breathing is part of the problem. A third of the problem is due to this long-term chronic bacterial situation you have. And then a third of the problem is that you're eating way too many carbohydrates on a daily basis. So again, we're going to start thinking outside the box, a little bit more overall viewpoint, as opposed to trying to pigeonhole everything into this one thing is the answer to this one thing. The next thing it might be is chemical exposure. So a lot of my patients are asking, do I have chemical poisoning? Maybe it's something I'm drinking in my water or breathing in the air, or is it where I work, or is it in the makeup I use, or. This is now, why you can see as we continue to go through this pie chart, you haven't been able to handle your health situation, nor has anyone else who gives you advice on the side, is because there are so many variables. It could be one of these things, two of these things, or all four of these things. So yes, we need to test you for chemical exposure and see if currently what you have going on in a health situation has to do with any chemicals either currently being exposed to and or possibly previous chemical exposure. Because unfortunately, some of these man-made chemicals are not able to be eliminated by the human body because the body was not designed to eliminate foreign compounds or isolates or synthetic compounds or man-made materials. So maybe the chemical poisoning you have right now is from 5, 10, 15, 20 years ago, and it got stuck in the tissue. Maybe in the fatty tissue, and it's why you can't lose weight. Maybe it's in the breast tissue, and it's why you're at a higher risk of breast cancer. Maybe it's in the brain, and that's why you have a little bit of mental fog, and you can't calculate, or you're not on point as much as you used to be. You can chalk it up to old age, but you can also chalk it up to possibly a cumulative toxic situation. So if you already have chemical situations, and on top of that you have a bacteria that's, again, suppressing your immune system, you're eating too many carbohydrates, and you're breathing dirty air, now you can see the reason for your health situation could be all four of these things. Another key category that has opened the door to miraculous handlings is DNA. Since they did the Human Genome Project, and we now know and understand human beings and their DNA literally right down to every single strand, this has opened the door to so many handlings for health situations that I have never had before. I get to know you right down to the individual strands of you. So what's also great about this is I can create a personalized, tailor-made program that's only right for you. So maybe your chemical exposure combined with your DNA results tells me that I have to handle this particular detox pathway in your body. But let's say your neighbor, who also has chemical poisoning, has a different DNA makeup. I would be handling their poisoning a different way than I would be handling yours. So on top of knowing each individual slices of the pie, which ones are involved in your case, which ones are not, we can also then, using your DNA information, make a program right down to the body biofunction and feedback for your individual needs. So never before have we been able to be so ultra specific and so accurate in getting to the root cause of your health situations for results that have never been as awesome as they are now. So the DNA is a huge component. The next one is that they're talking about the 5G and the EMFs. Is this a problem? It absolutely is a problem. The question is what percentage of the problem is it? So possibly the exposure to the Wi-Fi in your home, though, is a detrimental fact to your health, may or may not be the exact reason and cause for everything wrong with your health. Maybe you're keeping yourself in an ultra-sensitive situation due to your chronic EMF exposure, and maybe because you have a bacterial situation lurking underneath, this again is further suppressing the immune system. We don't know. This is exactly why we're going through the health chart here, to kind of expose all the reasons you might be ill, because again, now you can see maybe part of the problem is air, maybe it's bacteria, carbohydrates, chemicals, DNA, and or EMF sensitivity. So it's definitely one of the variables that need to be ruled out as to why you have the current health problems that you do. The next one is enzyme deficiency. This is huge. Do you know that basically your body on the inside is just one big container of enzymes? These enzymes make and inhibit your body from doing certain biochemical processes based on what time of day it is, what organs and systems need help, what you just ate, what you just did. So all of these enzymes need to be there, number one, and two, working together, and then three, either doing their proactive or their inhibitive factors on a daily basis, minute to minute, second to second, cell to cell. So a big part of what might be happening here is even if you needed to boost your immune system and or metabolize your carbohydrates better or start this chemical reaction, you're not going to do it because you don't have the enzymes present that provide the spark. So just like with a fire, you have the fire, you have the fireplace, you have the wood, you have the kindling, but what do you need? You need the spark to get the whole machine up and running. And that's what your enzymes do. It's like the fire or the spark for the fireplace. So if you don't have enough spark, none of the previous slices on the pie chart are ever going to go in to do their job. So you could have yourself on the perfect air filtration quality system in your house. You can have yourself on the perfect immune system support product, and none of this will actually take effect in the body, again, if you don't have the enzyme spark present to get the air handling detox to occur in the lungs and or the immune system to go and kill the bacteria. So enzymes are a key part of what we're going to be looking at that might be a contributing factor as well. The next thing is similar to the carbohydrate question, is it a fat situation? Are you eating too much fat? Not enough fat? Is the fat that you're eating actually being broken down, metabolized, and going to the body parts that you want it to? A lot of times people are eating fats and it's not even being broken down, and unfortunately it's being excreted the same way it went in. This brings us back possibly to an enzyme deficiency, more from a digestive component. Are there certain things that you need in order to get your fats working for you instead of against you? The other thing is with all these high fat diets, they're making it look like all you have to do is eat a lot of fat and you will be miraculously cured. Well, again, as a doctor doing this for 25 years now, I hope and wish it would be that simple, but it's not that simple. I have seen more failed cases on keto and high fat diets. It's basically almost what I specialize in now, is I get all the failed cases that couldn't get well elsewhere and or did too much on their own, not knowing what they're doing, not understanding bodies and health and biochemistry. And then they come to me and you're like, I did a high fat diet and I gained 20 pounds and I feel worse. And if they would have done the analysis that I do, we would have known that right out of the gate. So instead, they come to me finally, or unfortunately a little bit later, and they have so much damage that before we can even start improving on their health, we have to fix the damage that they created in their health in doing the wrong thing for the wrong situation. The next thing here we're looking at is it a joint thing? So I'm a chiropractor, by the way, and everybody says, well, do I need a chiropractic adjustment? And my answer, truth, honest, only ethical answer there is maybe. So what are we taking a look at here? So is the spinal component, is the subluxation, is the joint pain, is this the true primary cause to your health situation? Or possibly is it secondary, where definitely get a chiropractic adjustment for some symptomatic relief, but what if the true cause of the joints keep going out of place and causing pain is again due to too many carbohydrates in your diet, or due to a bacteria situation in the joint, or possibly that these joints are being affected by the Wi-Fi? All of these things are that sensitive that your joint pain has a 1 in several chances of actually being due to a musculoskeletal component. Now the thing is when that is the true cause, nothing works like a good chiropractic adjustment. When it's not the true cause, you can keep going visit after visit after visit and maybe see a little improvement and or some improvement, but it's only temporary. So again, we're looking at getting at the root cause of your health situations, and the joint component is definitely one of the components, and again is an equal slice of the pie, but no more important or no less important than everything else that you might have going on from a health situation. The next one here is mental health. So we're not going to get into this from a psychiatric evaluation. We're talking about just good mental well-being. Do you not have your spark anymore? Do you have a little bit of brain fog? A lot of people chalk it up to old age. You're like, oh, I guess this is what happens when I turn 40. I'm like, no, this is not at all what's supposed to happen when you turn 40 or 50 or 60. There definitely is a mental component. Now, it's due to deficiencies and poisons and toxicities coming elsewhere, but it doesn't matter because you in your daily life, it harms you and inhibits you as much as if it were a real phenomena, and that's why it gets a slice of the pie here. So you need to go out with a bright attitude and get out of bed and start the day and want to conquer the day, and if that's not happening, quote, from the mental component, we need to take a look at the other contributing pie slices here and see which ones could bring you back from the dead and bring back your vibrance, your will, and your personality, and just your excitement towards life. So again, we won't be treating you with psychiatric treatments, but we will be taking a look at it as a component of what is really going on, and there is a measuring tool to use to keep an eye on it to make sure you're moving in the right direction. So there definitely could be that component, and it'll be assessed as well. The next thing here, from chiropractic, acupuncture, traditional medicine, Chinese medicine, here you have the meridians. So these are the acupuncture points and energy flows that alternative medicine and traditional Eastern medicine talks about and educates you on. You could have some stuck meridians. So possibly people ask me, should I go see an acupuncturist? Well, after we do our assessment and we take a look at this particular slice of the pie, after we've taken a look at all the other ones as well, we're going to put in priority order where acupuncture falls on the chain. Because one of the key things about these slices of pie is not only knowing they're there, but more importantly is putting them in order in the correct sequence in getting your health situation handled. So maybe we have some detox to do and some immune support that we need to do over the next 3 to 6 months. And then let's say the next thing in line would be going and handling and balancing your meridians. We would throw in acupuncture maybe about 6 months from now. Let's say the meridian imbalance is so severe, it's just kind of throwing you off as a person top to bottom. Maybe we'll start with acupuncture. In a good way, it doesn't matter to me which ones we need to do and or not to do. The fun for me and what I'm trying to achieve you is, number one, isolating out the ones that actually are contributing to your health situation, handling those and handling them in the correct sequence. So that's what I'm all about. This is not about should I do this or do that, buy this product, don't buy this product, see this doctor, get this treatment. In a good way for me, it doesn't matter. It's again a personalized, tailor-made program. And based on the analysis that I'll do with you, we will absolutely be certain in whether it's all of them, some of them, or any of the current pie slices we've already talked about. The next one here is that there could be heavy metal poisoning. This is a big one. So again, due to the nature of the man-made substances and the high-tech world that we live in, people are being exposed to heavy metals more and more often. Again, not necessarily a bad thing. Where it becomes a bad situation is if your body can't chelate them, metabolize them, and excrete them normally and in a healthy fashion. So do you have heavy metal poisoning? Possibly. And will we need to assess you for heavy metal poisoning? Of course we will. And then we'll see. Maybe it's a metal situation and not a chemical situation. So all we know is that we need to handle the heavy metal toxicity if it's there. Next thing here is, again, minerals. People are on calcium and magnesium and they're taking potassium and they're taking sodium and they're reading online that, oh, I think my headaches are due to potassium deficiency, or oh, my headaches are due to a sodium deficiency, or oh, it's due to a copper deficiency. Any one of those things can actually be true. But that's what I call slapdash nutrition. That's like just, grabbing things randomly to see if it'll work. Your health and your health journey needs to be a lot more specific and a lot more accurate than just throwing some stuff at the proverbial wall there and seeing what sticks. We want to actually know what's part of the situation and what's not. So too many people waste money taking minerals every day that if the body doesn't need them, you just excrete them out. It's funny that people think that your body is like a storage unit, that like, oh, if I take it, if I don't need it, I'll just put it to a side. It's like, no, it won't. In keeping with the enzymatic reaction, if it has too much copper coming in for the day and it's like, we don't need all this copper, it's not like, oh, let's put it aside for a rainy day. The body just excretes it. So at best, you have very expensive urine. So this is the mistake of taking your nutritional advice off of line, is that no one's really telling you the whole story. Like people are like, take copper, take calcium, take magnesium, eat more fat. It's like, maybe. But if you have a particular model or machine that doesn't need the copper or doesn't need more fat, then it's actually going to, number one, either be a waste of money and or two, possibly accumulate, because some of these things do actually stay in the body, but not to the good, and will cause further damage. So if you don't have your mineral ratio correct, taking too much of one mineral actually makes you deficient in the mineral that works exactly opposite it. So the way minerals work in the body is they all have their counterpart. So it's kind of their equal and opposite friend. So for example, when I'm present, then the other one goes away, and that's the vice versa of that is when that particular mineral is present, then my job is to go away. And how the body will make it go away is it'll excrete it out. So if you have the improper ratios of minerals, and you're taking too much calcium or too much magnesium or too much potassium or too much sodium or any other one of the minerals, if you take too much and don't balance it out correctly with its counterpart, you will actually end up being deficient in the opposite end, and then you'll start having symptoms for that. So let's say you're taking calcium, but you're not taking magnesium. And then all of a sudden, 6 months later, you go online, again, big mistake number one, but you go online and you see all of your current symptoms that you've had in the past 6 months now mean you have a magnesium deficiency. Now you start gobbling down magnesium. Well, you're trying to treat your body medically like that's a symptom. So now you have too much calcium in there, you've depleted your magnesium. Now you're trying to do too much magnesium. Guess what you're going to end up doing? Depleting the calcium. And then if you keep trying to increase both, more calcium, more magnesium, more calcium, more magnesium, there is a saturation level in your body where it's going to be like enough is enough. And again, you won't utilize it. So you keep trying to handle, and you're not getting anywhere because you're coming at it from the exact opposite end or approach. So again, that's where my 25 years of hands-on clinical knowledge and training experience and my knowledge and understanding of bodies and biochemistry come into play, that when you come to me, I can actually tell if what you're doing from a calcium and magnesium standpoint, let's say, is actually the opposite of what you're trying to achieve. I see that all the time. People doing the exact wrong thing because somewhere online there was an article substantiating that that's what you do, and yet for this particular body, this particular person, it's the exact wrong thing to do. So half my job is actually undoing all the damage you've currently done before, again, we can get into each individual pie slice and start fixing and handling the true reasons for your health situations. The next one, very similar. When people ask, should I go get a massage? I have a lot of inflammation. I have a lot of pain in my muscles. And again, the answer I'm going to give you is, I don't know. Again, only honest, ethical answer. Now, my job is to eventually to know, but if you just like walk up and bump into me in the street and be like, hey, I'm having pain in my muscles, should I go see a massage therapist? I'm like, I don't know. I don't have enough data or information. So I tell the person, like, come in, we'll go through the whole initial health evaluation. I'll see which parts of the pie chart you have, which ones you don't. And if muscles is on the to-do list, the wish list, let's say, and your body's like, yep, we definitely have a situation here, then my recommendation is going to go see a massage therapist. If the true muscle situation is being caused by, again, possibly an immune system situation, chemical poisoning, bad air quality, the EMFs in your home or your life, possibly you messed up your muscles by giving them the wrong amounts of calcium and magnesium. So sometimes the only thing I have to do with the patient is getting them to stop doing what they're doing. So like, I have all this pain and inflammation in my muscles and I'm taking all this calcium and magnesium and I don't feel any better or I'm getting worse. A lot of time my recommendation is stop the calcium and magnesium, and lo and behold, 3 to 6 weeks later, they're like, oh, all my muscle pain went away. Here I thought I was going into a disease process, and I'm like, no, you're just poisoning your poor muscles with too much calcium and magnesium. So sometimes the right thing to do is nothing. So very interesting. But the job is to figure out how to know what that is, and that's where my expertise comes into play. The next thing here, from an immune standpoint, parasites. People read things online about parasites, freak themselves out, by the way, scare themselves half to death, worry. It's like, okay, parasites, not your favorite thing. But the bottom line is if they're part of why you have the situation, you do great. And if you don't, you don't. And we handle them accordingly. So based on the analysis that we'll do, we will check and see, is it bacteria? Is it not? Is it chemicals? Is it not? Is it a muscle situation? Is it not? Are there parasites present or are there not? Because you can go online and you can read all kinds of joint and muscle pain. Oh, it's due to parasites. And people start putting them on all of these natural handling, buying these wicked herbs online and trying to do a detox of their parasites. It's like, okay, you know, it's like your body's a little bit, again, more complex than that and needs a little bit more TLC than just kind of slapdash nutrition. So let's again assess, number one, and see, is there even a parasite situation? If there is, what would be the exact precise handling to do with you and your body? The next thing here, again, similar to the fats and the carbohydrates, is protein. Maybe you need more protein, maybe you need less. Oh, well, the guy online, and he's the internet nutrition guru, and he's telling protein, protein, protein. And he did protein, and he wrote a book on protein, and he cured every ail he had in his body top to bottom with eating more protein. And that's great, but guess what? That's only great for that particular guy. Because, based on his pie slices, guess what the only problem he had was a protein deficiency. So of course, if he ate lots of protein, miraculously everything in his body goes away, because why? The only problem he had was a protein deficiency. But again, what if you have a parasite? What if you have a suppressed immune system? What if you're sensitive to EMFs? What if you have heavy metal poisoning? Is eating boatloads of protein going to handle your situation? No. And if it does, it's only going to handle, as you see, again, the percentage of the pie slice that is the problem. So if you have 6 different problems and you eat more protein, protein's one of the 6, you will have 1/6 improvement in your health. And that's great. But what about the other 5/6 that you haven't addressed? So be careful of, going online and reading in and listening to and thinking that whatever you're learning is the absolute. I'm here to tell you that it's almost the exact opposite, is that number one, you actually don't know. And the only way you're going to actually know is through proper assessment and proper handling once the assessment is complete. The next thing we have, again, similar to the mental, there is a spiritual component. In a good way, I'm not going to get into what your belief system is, but you are a spiritual being, and there's a part of you that's absolutely you. What we're trying to do is not handle that directly. I'm not going to become your spiritual counselor or getting into the spiritual aspect, but what we do need to do is recognize it and acknowledge it. And then that's going to be whatever it's going to be. But my job is to do the physical handling and handle the rest of the pie chart so that you, from a spiritual standpoint, can be the biggest and the best and most awesome you that you can be. So you're going to work on that elsewhere, whatever you want to do and what you're being and you're trying to achieve and the spiritual enlightenment that you're trying to achieve this lifetime, then great, you go have at it. My job in relation to that is you go be the awesome you that you are, and then I'm going to take the machine, the vessel that you're kind of carrying around with you all day long, and I'm going to get that in tip-top shape. I'm going to detox it. I'm going to have it breathe better air. I'm going to make sure its mineral balances are questioned. I'm going to make sure you're feeding it properly. So then that way, when you carry it around, the most vibrant, wonderful, and clear-headed spiritual version of you gets to be out there living life every day. So is it a component? Absolutely. But again, it gets thrown into the mix in keeping with the priorities and what we're really trying to handle from a body and a health standpoint. The next thing we talked a little bit about when we went over in the joints is like, is there a joint situation? Now you have the true chiropractic, the subluxation. So that could be it. People are like, I have neck pain. Should I go see a chiropractor? Maybe. Or, or it's like, should you do an adjustment on me? And my question is maybe. Again, I don't really know until I do the full assessment. So is it truly a joint out of place? Is there muscle spasms in there? Are there mineral deficiencies in there? Is there chemical toxicity? Is there heavy metal poisoning? Are there parasites in there? I don't know. So once I have the answers to all of those questions, then I'll be like, yes, you need an adjustment, or no, you don't need an adjustment. I don't know. So, but again, it's an equal piece of the slice of the pie, and it's going to take no more precedence or less than anything else. It just needs to be taken into consideration. The next one here, from an immune system standpoint, we talked about the other category, viruses. Oh my goodness, so much information on the internet now. Everything's a virus, virus, virus. You see vaccines coming out for the virus, and that's the medical handling, and they're trying to solve the virus situation. They're talking about viruses and cancer. Is that all a situation? It is all part of the situation. So is there a virus situation going on? Do I have high risk of certain diseases and illnesses due to the viral load? Of course you do. But the question is it the most important? And if it isn't, is it even there to begin with? Do you know that your immune system actually just can only give you broad general problems, symptoms, etc.? So let's say, for example, you feel hot. Wow, that's a biggie. So hot what? Hot flashes, hot because of a fever, hot because you have hydrochloric acid going back up into your esophagus, hot because you have adrenal stress. Why are you hot? One of the reasons is you can have a bacterial fever, you can have a viral fever, you can have a parasitic fever, you can have a Lyme disease fever, you can have a hormonal fever, you can have an adrenal fever, you can have an estrogen fever. All of this stuff, all the body knows is like, you know what, we need to get your attention. So we're going to turn up the heat here on the inside and get you to finally take a look. But unfortunately, what people do is they go online and be like, why am I hot? And then all of a sudden, all the experts tell you all the reasons you're hot. And it could or could not be any one of them, all of them, some of them, none of them. And again, what we have to do is go on the chart here and find out which ones are the reasons why you're feeling this hot sensation, okay? And then the viral component is just another thing. So you go online and people are like, oh, well, I read online that I need to take this for immune system because it's good for viruses. And I'm like, did you even have a virus? Well, I don't know, but oh, and here we go again. So we're taking a look at the key components here. So viral situations most of the time can and will mimic a bacterial situation. Viral situations can and will mimic parasite situations. So here you are, you have yourself on this most beautiful viral herbal program regimen that you read online and purchased and started doing, and yet all of that immune system support is to handle a virus. But yet you have a parasite. So are you going to get the symptomatic improvement you hoped? Of course not, because you're kind of right train, wrong track. You knew it was an immune system situation, but you handled it inappropriately with the wrong support. So again, my job is to find out, is there a viral situation? If there is, great. And if there's not, move on. The next one here, from a broad general standpoint, is the whole issue and question of vitamins. I should be on vitamin A, vitamin B, vitamin D. I did my blood work. I have a vitamin D deficiency. I read Joe Jones, MD, online, and he said everybody on the planet has a vitamin B deficiency. Maybe, maybe not. So again, through proper analysis, getting to know you, your individual needs, we will be able to determine, is it vitamin A or not? Is it vitamin C or not? Is it vitamin D or not? I don't know until we do a full assessment. So vitamins are very important, same as the minerals. You can take too much. You can actually create toxicities and imbalances if you're taking the wrong ratio, because some of these vitamins work opposite of each other. So taking too much of one thing can actually increase your risk of certain diseases and problems. For example, vitamin A. Vitamin A taking as a standalone can actually increase your risk of women with having birth defects and cancer. So you have to know, do I even need the vitamin A or not? And what kind of vitamin A? And then more importantly, in what ratio to the other ones? So you're looking at some of the other vitamins that work with and or against vitamin A, and you have to make sure they're also in balance as well. So to just randomly, blindly take vitamins based on something you read online, or take a multi because you're just trying to do a catch-all, bodies don't work with catch-alls. Your mindset and the body's mindset are two completely different things. You're thinking, oh, I need vitamin D because I want to support bones. So I'm going to support my immune system, my bones, and I'm going to take a little calcium. So you start taking calcium and vitamin D. Your body doesn't know that you wanted that to go to the bones. You assume because you read online that vitamin D and calcium is good for bones, that's where the body's going to send it. But that's not how a body works. A body might be sitting in there and all of a sudden it sees all this vitamin D and calcium coming in, and it's kind of sitting there, if your body had a personality, and it's like, what's all this about? Why is she taking this? And if the body's kind of like, what does she want me to do with this? And you're all sitting there, oh, well, I'm taking vitamin D and I'm going to cure my osteoporosis. And meanwhile, your body's in there kind of saying, you are? It's like, nobody told us. So again, there is an actual sequence and an actual technology to doing nutrition correctly and actually getting it to work. You blindly popping pills every day doesn't magically have the body know what you wanted to do with that. The body also is going to take that stuff and use it in the order that it wants to. So let's say it is calcium and you want to take it for osteoporosis, but you're calcium deficient across the board. Do you know that the bones is one of the last places the body will send it to? Because there's other body parts like the brain and the heart that needs calcium as well. So if you already are calcium deficient, you're taking your calcium support, and you're like, okay, next time I go for my bone scan, it's going to be improved, and you go and it's no better or possibly worse. That's because somebody else was taking all the calcium. So on that, on top of everything else we talked about here, means you were on the wrong dose. So if you were taking 500 whatever milligrams, grams, international units of vitamin A, D, E, K, calcium, magnesium, phosphorus, potassium, whatever you're taking quantity-wise, if you're not doing the right amount, you're not going to get the therapeutic value all anyway. That's a whole other video series that we're going to do, but not for this one here today. So we're looking at many components. So you're looking at the correct supplements, vitamins, minerals, dietary habits, components. You're looking at the correct quality of those things, and you're looking at the correct quantity of those things. So that's really an algorithmic, mathematical, long calculation. And that's why I'm telling you the body is so complex in this regard. So you need someone who actually can take this complexity known as the body and your health problems and break it down into its simplicities. And in order to do that, you need to do a full analysis of all of these things and to find out which ones are on the yes list and which ones are on the no list. And finally, a huge situation, water. People are asking about water. Water's bad. It's all toxic. Basically, at this point, not to go all doom and gloom on you, there is absolutely no good water on the planet. even if there is good water, there's trade-offs, and I can't even get into that on this video. That's a whole other video in and of itself. But is the water quality you're drinking, is that potentially a part of your health situation? At least from our health pie chart here, I can say it absolutely is. So I've actually had many people who've actually had to stop drinking the water that they're on, bottled water, filtration systems in their home, etc., because they were doing the exact opposite of what they needed to be doing. So we're not going to get into all of those. That's a whole water video. That's a separate issue altogether. But as part of the analysis, possibly the reason you have joint pain, the reason your immune system is suppressed, the reason you have heartburn, hot flashes could be due to some poisoning or toxicity in your water. So the water will be addressed. So you can now see, in order to get you well, this is really what it's going to take. When you go online and you do research and you read articles, as you can see, every single one of these things are there. There's some medical expert saying that it's all about your DNA, and then there's some medical expert telling you it's all about viruses, and then there's some other medical expert telling you it's all about heavy metals. The problem is that they're all right and they're all wrong at the same time, because they only represent one slice of the pie. So they are correct in saying that what might be going on with you could be what they're talking about in their blog, their video, etc. But what they're not taking a look at is all the other arbitrary facts that may or may not be included. And it's finding out again, number one, all of the factors that are there or aren't there, and then most importantly, getting them in the correct sequence with the correct quality products at the correct doses. And then when you have all of these factors together, that's when the true magic occurs. So this is what I do for my patients, and this is how I get the miracles that I do. And it's just amazing and wonderful, and what it allows me to do is be absolutely correct every single time. So again, no slapdash nutrition, no guessing, no just throwing you on stuff and hoping for the best. We're going to isolate out each one of these key pie slices for you and you alone, and we're going to handle those accordingly based on your findings. Thank you so much for watching my video today. Have a great day.